Well, it gives me great pleasure now to welcome Nectarios to join us to discuss dental issues for head and neck cancer patients. Could you begin by just introducing yourself? Imagine a patient who's just been referred to you. Can you introduce yourself and tell us, the key elements of your experience that go to head and neck cancer patients, please?
Well, first of all, Julie, thank you for your infectious enthusiasm, and secondly, the great work you're doing in this field. Yes, my name is Nick Andrews. I'm a dentist that works as part of the multidisciplinary head and neck team in departments of radiation oncology. I'm also a general dentist in part-time in suburban private practice. And so I've been lucky enough to experience both sides of the divide, the private practice side of things and the hospital dentistry side of things. And my role as part of an MDT or multidisciplinary team is to anticipate and discuss and inform and mitigate the potential dental side effects of head and neck cancer treatment. So my role is to explain to the patient, talk them through what they can expect during treatment, immediately after treatment, and long-term further down the track. And teach them strategies to cope.
And strategies to cope. And you've been involved closely with a number of different cancer centres in Sydney?
Yes, I've been lucky enough to have worked for 27 years with the St. George Hospital and 28 years at Westmead Hospital, and for a period of about 5 or 6 years out at Liverpool Hospital as well, 3 big cancer hospitals in this state of New South Wales.
Look, Nick, you've had obviously extensive experience, and in our conversation, we're going to look at a whole range of the aspects of your work, both assessing a patient's dental needs before their treatment, and then most importantly, assisting them to manage the results of treatment in their mouth and teeth and to prevent, to the degree possible, deterioration in health. But I want to begin with an overview, I guess, of your concern, despite the great work of the cancer clinical teams, your concern for many of your patients who struggle in the longer term. And I want to read something that you've written as part of your bio for this series. You said, "For too long, dentistry has inexplicably been excised from medicine as a whole, at least in the eyes of some health bureaucrats and politicians. The long-term impacts of head and neck cancer treatments are lifelong, and the most vulnerable of patients, having already battled a cancer diagnosis, are too often doomed to a life of devastating dental pathology with crippling functional and emotional outcomes. We as a caring society and they deserve better." Now, they are amazingly powerful words for a dentist. Why do you feel so strongly that we need to do something better for the dental needs of head and neck cancer patients?
Well, it's a very emotive field. I think anyone, as you well know, has been through a cancer diagnosis understands how terribly traumatic it is to get your head around. And while we're getting very good at treating the disease, we're not as good as we should be in managing the long-term outcomes and improving the patient's quality of life. Unfortunately, many of the patients who come to us have already been in a situation where their dentition has been neglected through socioeconomic reasons, through geographically remote reasons, through lifelong habits such as tobacco and alcohol abuse. So they're behind the 8 ball to begin with. Now, we come along and fix their disease, but create conditions in their mouth which are only going to exacerbate their existing problems. And access to long-term dental care is a real problem in this country. We readily accept the eyes at the gateway of the window to the soul, but surely the mouth is the gateway to the rest of the body. And so there are so many ways in which the mouth is intimately related to the rest of our general well-being, whether it be through malnutrition, whether it be through associations with cardiovascular disease, whether it be simple emotional pleasures like enjoying a meal, enjoying good food and drink, the ability to communicate with others, psychosocial interactions, intimacy. All of these things are really important. So the mouth is vital to our general well-being, and yet it's been overlooked.
And the critical thing in terms of a basic introduction is, as I understand it as a patient, is that the impact of the treatment, and we'll talk about it later, but a very important part of that is, of course, the damage to the saliva. But the impact of the treatment actually gets worse over time, and yet our medical health system lets us go at 5 years. We're considered the checking and the engagement with the multidisciplinary team tends to stop at 5 years. So am I right in thinking that the real hard impact on the mouth and our teeth hits when we're not connected to that original hospital team?
Yeah, there's a real issue with long-term survivorship and follow-up. As you say, after 5 years, you're patted on the back and told everything's great, we don't need to see you again, and you're considered cured. But we know that a certain percentage of these cancers will recur, and we do know there's also a very rare risk, but a possibility of long-term radiation-induced disease that may occur. Many of these manifestations develop many years down the track. Certainly damage to jawbone is progressive. The potential for trismus or limited jaw opening, which impacts on the ability to maintain the mouth, is a progressive condition if not diagnosed and managed early. The potential for radiation caries or rapid tooth decay in the context of a dry mouth can be a significant problem down the track. So there needs to be a better way for patients to be able to reconnect more seamlessly into the treatment centre in the first place and seek proper follow-up care.